My son assures me if I put my sweatshirt hood up that the bugs won't bother me, so we can't go inside. All right, second surgery. So, second surgery went well also. They did do the Dura patch where they take that bone and they kind of pocket it outside the spinal cord to make more room for the brain and for the spinal fluid to flow. I was very happy because they didn't have to take a graft from my leg, which would have been painful. They actually used they also took more skull out. So they used the bone from my skull that they took out to form the patch. So that was exciting. I did not even know that was an option. So it was really, I felt like I recycled a little bit more. That they were able to use the bone that they already took out, so they didn't have to do an incision in my thigh. So when I woke up, that was exciting. I had, of course, some really good pain meds and PACU, which was good. But this time I decided to do the second surgery without taking narcotics, so that made me feel a lot better, less nausea. I again was out in 24 hours. I am fairly typical healthcare provider where I don't like to stay in the hospital at all. So I will meet all my criteria as fast as I possibly can to get out the doors. They wanted me to stay a second day just in like general care, one in neuro ICU, one in general care, but no thank you. I know how many germs are in hospitals and I wanted to get out of there. So they let me leave the day after, and I was feeling fairly good. I mean, typical pain, numbness, same stuff as before. I think in general I felt better the second surgery. Getting home was tricky. It was an hour drive, but my mom actually was the one to spend the night. My husband spent the night with my first one, but then, the kids needed to be taken care of, so he was with the kids and my mom. My mom got to spend the night with me, so that was really nice of her. She brought me a lot of fruit. I ate tons of fruit, so that I think was a good check mark to get out of the hospital too, so thanks, Mom. So, starting the road to recovery for the second surgery. I took longer. Yeah, I took about the 12 weeks for the second one. It was harder. It was harder to bounce back than the first one. Just because my symptoms of Chiari got so bad too. So you don't know what's post-op complications versus your worsening Chiari symptoms. It's just sort of a world that nobody wants to live because it's difficult to decipher between the two, so some things got worse. Not a whole lot improved, I've got to be honest. I think I've had one really good day since my second surgery, and it's September. So that's a little upsetting, but now I don't know if that's just my new norm or if the surgery worked. I have a MRI scheduled for January, which I thought was kind of long to wait. Typically 6 months would be at the November point, but they scheduled me in January for the follow-up MRI to see if things have worked. So it's that dreaded waiting game. I'm back to work. It's hard. I decided to go back full-time just because being a nurse, I felt guilty doing half shifts because then they have to rework the schedule and people, there's help sometimes and not. So being the smart person I am, I'm on full-time 12-hour shifts. And to complicate things, I have a cold and the cold won't go away. It's been going on for 3 weeks, the exact time I've been back to work. And I am on antibiotics for sinus infection, so which I can talk about that in a different video, just what makes Chiari worse. Colds and bad weather. But anyway, so that's pretty much how the second surgery went. I'm still waiting on whether it was successful or not, and just trying to make every day count, so to say. I do the best I can and try to take it easy as much as a nurse with a 5-year-old and a 3-year-old with a large house can do. Bye.